Hi, my name's Kathy and I'm from Michigan, and my story goes back about 20 years ago. I was having recurrent sinus infections, so I had gone to the doctor, and he thought if he operated on my deviated septum that I shouldn't have so many infections. So I asked him what the risk was of this surgery, and he said, well, what's the risk of you riding the car? And to me, with him saying that, and me being optimistic, and it just being outpatient surgery, I didn't think it was that big of a deal. And I was in for a very, very rude awakening, because it was the worst thing that's ever happened to me in my life. When I woke up from that surgery, I knew immediately that something was terribly wrong. I felt so funny. I was so dizzy. This side of my face just felt very hot from my heart up, and I was vomiting blood, and they ended up admitting me. I was shivering and shaking. They released me the next day. I still felt very weak and pale, and I just wasn't feeling very well, but I went home and thought, just take a couple of days, recovered. And I could barely walk to the bathroom because I'd feel electricity feeling right down to my heart. That just jolted me. I'd have to go sit down, and eventually that did subside. But my parents knew something was wrong with me. I wasn't the same person. I just go to my bedroom and I'd be laying down all the time. I just felt so weak. I couldn't even sit up on the ride home from the hospital. And I no longer wanted to go out with my friends very much. It was like the wind was knocked out of me. As summer came, I started feeling better. I'm sure it was due to the humidity and the heat. And I did meet a guy that turned out to be my wonderful husband, and he took me out to the Mayo Clinic, and they did a bunch of tests, and they said, well, nothing's wrong with you. But then we were a little bit persistent and told them it was after that surgery when I started feeling all these complications. And so they sent me to a doctor who was one of the most compassionate doctors I've ever met. And he said, well, yes, there is. He believed me and said, you have empty nose syndrome. And although there wasn't much they could do for me, they did send me to the pain clinic, which we couldn't make our appointment because we had to go back to Michigan, but at least I knew what it was. So I came home, and just about a year or two after that, I started feeling a lot of pain in the back of my head and severe pain in the back of my back, and it was just like I fell off a motorcycle and I crashed my head on the cement. That's how painful it was. I thought I was going to go crazy. I thought I was going to have a nervous breakdown. I never felt anything like that. So my husband took me back to the Mayo Clinic, which I would have never made it out there without him because of this condition. I would have never had the energy. And I went back to see this compassionate doctor again, and he asked me to stand up and show the intern where my pain was, and he said this is where females seem to have some of their pain when they have this condition. And luckily after taking some pain medication, it finally went away. It still comes and goes, but it's never been that severe. I've had a lot of ear popping and squeaking, and the pressure is so awful in my ears that I can't hardly sleep at night at times, and depression does set in. And yes, I've thought of suicide before. It gets that bad, but luckily, as the days and weeks go by, some of the pain starts subsiding, but it comes and goes. But I've had a lot of miserable days where I missed graduation parties, my own nephew's graduation parties, birthday parties, the list goes on. I'm just not the same person that I was. The life has just been sucked out of me. I'm not the fun, easygoing person. I get my concentration's not nowhere where it was before, and there's sometimes I get so weak that I have to lay down and my arms are just like jello and I can't do anything at all. And matter of fact, when I was out the Mayo, my husband had to push me in a wheelchair. Some days if I had to choose between having my turbinates and my legs, I would choose my legs, because you need your concentration and your energy to live a proper life. And I just have to take one day at a time. And I just want to thank everybody who is supporting us and doing something for us, and hopefully there will be a cure for this miserable condition. I know I don't take care of myself like I used to in my appearance. I just don't have the energy like I used to. And I want to thank Chris Martin for writing that book, and I hope nobody has to go through this. I wouldn't wish this on the worst person in the world. It's that bad. And I thank everyone, and God bless, and to all the ENS patients, hang in there. Thank you.